Hey, Grand Tribe members, we are going to find out how somebody who has dreams and aspirations of becoming a ballerina ends up transitioning and going into the field of regenerative medicine. Now, today's guest is Dr. Roberta Shapiro, and she is a professor over at Columbia Medical Center at Columbia University and is really focused in on how regenerative medicines can help us age well, help us prevent and even recover from, let's say, skin issues, all the way to degenerative disc disease and some of the other ailments that we either inflict on ourselves because we're active, and then also because it's just part of the aging process. Some of our joints, our knees, our hips, our backs, they all just wear out. So you're going to enjoy this conversation with Dr. Shapiro. I did. We geeked out over a couple of different things as I was learning more information. So I hope you do as well. And before we get started, a word from this week's sponsor, Road Scholar. The moments your grandchildren remember most are the ones you share together. With Road Scholar's Grandparent Adventures, you'll explore incredible destinations, learn from expert instructors, and discover the world side by side. From national parks to wildlife encounters and hands-on cultural experiences, these programs are designed to bring generations closer through the joy of learning and travel. Learn more at roadscholar.org/grandadventures. Hi, Dr. Shapiro. Welcome to the Grand Tribe podcast. We're excited to have you on.
Thank you, Greg. I'm excited to be here.
I would love for you to give us a little bit of a background as far as your focus of research in longevity and some of the highlights.
So very briefly, I started life as a dancer, a ballet dancer, and I had an injury when I was rehearsing. I was dancing with a semi-professional company out of Carnegie Hall called Children's Ballet Theater. I had an injury which led to back pain and sciatica, which led to me searching out doctors that finally were able to help me, which led to my interest in musculoskeletal medicine, which then led to my interest in going to medical school. From medical school, I studied more musculoskeletal medicine and developed an interest in regenerative medicine by studying physical medicine and rehab, and ultimately joined Columbia University's Department of Rehabilitation and Regenerative Medicine, where I furthered my work with regenerative medical and longevity types of treatments. And then ultimately I ran into a company called Cressel, where I have now become Chief Medical Officer at Cressel. Cressel is a biobotanical topical agent that is made of aloe and oat kernel oil that has tremendous regenerative capacity. So I became very obsessed with this product and how it can be applied. So now my applications of my own time are in my regenerative medicine clinic at Columbia University and with Cressel.
I always love hearing those stories about what inspired or what paths people took to get to where their passions are and where their careers take them and all of that. And that sounds fascinating. I bet you when you were dancing, never in a million years would you have guessed that you would have gone into longevity medicine.
Never would I thought medicine at all. I didn't want to be a doctor. My brother was a doctor. And so, no, I never imagined that.
When it comes to longevity in medicine, are we really focused on just adding years, meaning just getting down, I guess, just get the digits going? Or are we really focused on how to create longer, meaningful relationships with those years that we have?
So I love that question, actually, because it's a topic that comes up every day in my practice, where patients will literally say to me, I want the quality of my days to be better. I'm not as interested in the number of years that I have, but the quality of it to be of a higher level. And I am of the belief that you cannot separate those two out. If I'm improving the quality of somebody's life, I'm usually adding years to their life as well. And I love to give the example of a patient that we've been tracking at Crescel, as a matter of fact, but he's a 76-year-old military veteran who 37 years ago was in a motor vehicle accident and sustained a spinal cord injury, and he's a quadriplegic. It's very difficult to live life as a quadriplegic, but he maximized the function of his life with family and friends and activities that he was involved with and work. He really maximized the function. But after a certain number of years, even the best cared for quadriplegic on earth, and he has been the best cared for, I can imagine, they develop skin breakdown, which affects the quality of life and the duration of his life, because these are life-threatening wounds that develop over time. So he's been bound to his bed, no quality, no interactions with his family. His life has really suffered dramatically. And about a year ago, he crossed paths with us at Crescel, and his daughter, who's a nurse and his primary caretaker, decided to give it a try, and she chose one of the lesser involved wounds to try it on his shin, and it closed. And so it gave her the courage to start using it in other locations. It has so dramatically changed the quality of his life that we have also added years to his life. He's back to living it. He's back out of the house. He's interacting with family and friends. And so to me, this is also an aspect of longevity medicine, not just, the nice and shiny new stem cells and exosomes and peptides and all the things that we talk about. Sometimes it's just quality of life and that adding to duration of life. So I can't really separate those two out. And I love that question.
Well, thank you. And when I'm hearing your response to that, I'm also starting to think about the people that are maybe in nursing homes or at home care. Were these wounds similar to what we hear about as far as bed sores and that sort of thing?
Yes, they're bed sores or called pressure ulcers or decubitus ulcers. It's the same thing. It's just chronic pressure in one area decreases the blood supply to the area, the oxygen, the nutrients, the layer under the skin surface breaks down, and then the skin breaks down. So these are inevitable in people who are bed and wheelchair bound, even under the best of circumstances, and they are life-threatening wounds. And so in Eric's case, the patient that I'm talking about, the quality of his life has so dramatically changed that, again, it will add years of interaction with family and friends. Because what is longevity medicine at the end of the day? What is anti-aging at the end of the day? Aging is based on a series of inflammatory reactions. We now know that. The more inflammation we get, the less blood supply we get, and healthy blood and oxygen and nutrients to organs, the more disease we develop, and chronic illness develops, and aging develops. And so if we can decrease the inflammatory process in whatever way possible, and some things are very basic. It doesn't have to be these expensive, crazy treatments. It can be as easy as diet, exercise, and social interaction is part of longevity medicine also.
And I imagine too, and I'm sorry, I love this area because I've got people that I know that are also amputees. And does this help with the area that had been amputated?
So Cressel is an incredible product, since you're bringing it up. It really has very diverse application. It is literally applied for any type of skin inflammatory condition. It can be rosacea, psoriasis, eczema. It can be wound care. It can be burns. It can be dermatitis. It can be decubitus ulcers. All of these areas of treatment are amenable to what Cressel does. It actually increases the blood supply to the area, which enhances the regenerative capacity, and it works on a microscopic level. It penetrates the mitochondria of the cells and is truly an intelligent therapeutic. So in the case of amputees, absolutely the stump, for care of the stump site and the skin breakdown that they get, Cressel can be healing in those circumstances. We can definitely apply it in those areas, but I'm more interested in preventing the amputations, which actually is such an interesting direction to go, because how many of us as we get older develop diabetes? And one of the biggest complications of diabetes is our foot ulcers or wounds that are non-healing, which lead to chronic wound care, very expensive biologic occlusive dressings. very painful surgical debridements, and ultimately amputation. If I can prevent those things from happening, I can also slow down the aging process and improve the quality of people's lives. And so we can look at longevity medicine as preventative also. What do? We already have a diabetic patient. We know that they're at higher risk, so have them apply something that can prevent the breakdown, that can prevent the wounds, that can prevent the ultimate amputations from occurring.
Well, that's awesome. Yeah, I mean, the less we have to deal with that, the better I think everybody is, and especially like you said, with the diabetes and some of the other health issues that happen to us as we age, being able to avoid that and even change our treatment schedules and what we do is huge.
Greg, it's incredible. And also the field of biobotanicals is one that we've got to acknowledge more in this country, because those are the things, the treatments that actually get to the underlying disease process, as opposed to just masking the symptoms, which is what we do with synthetic drugs frequently, and we have for the last century done with drugs. But the area of regenerative medicine and biobotanicals are really the future for healthy care and anti-aging. That's where we have to make a stand. And that actually can I jump off into another topic for a second about this?
Let's go ahead.
Because the world of regenerative medicine and longevity care is so obsessed with how we get there, right? I have patients that are healthy in the way they look at it, and I have patients that are obsessed with every single morsel of food they put in their mouth, every bit of exercise they do or don't get, every bit of sleep they get, all important factors, but it's about balance at the end of the day, and you can't be so hyper-focused on these things. And the other thing that they hyper-focus on are the treatment modalities now being talked about that are cool, right? The stem cell treatments, the exosome treatments, the peptide treatments, hyperbaric oxygen, all of these things that definitely do decrease the body's systemic inflammatory reactions and should help to slow down aging. But we can't afford to access those treatments, right? We don't, they're so expensive that how do we even approach that? So that's a whole nother topic for discussion that we could have and launch off into, as well as the fact that China is killing us and beating us in this race. It's a new arms race with healthcare, essentially, with China, and they are absolutely throwing us under the bus with the speed with which they are developing new treatment protocols. It's really incredible. And they have tracks in regenerative medicine and biobotanical medicine acknowledging that these should be standards of care and are cost effective in the long run because they prevent other diseases and expensive treatments from being necessary, from developing and being necessary. So there are a million different directions we look at in the field of regenerative medicine right now and longevity care.
I do want to dive into the cost aspect for regenerative care and for aging well. Are we at a point where, my frame of reference is when DVDs were first coming out, right? And it was $1,000 to buy a DVD player.
Yes.
And now you can go to Walmart and get it for $25. Exactly. Are we at that point where it's like, hey, we have treatments available, it's going to be very expensive, but as we have more adopters, that price point is going to be able to come down due to the economics?
I'm so glad that you said that, because I look at it as two things to bring the cost down. It is prohibitively expensive to access right now, which is a problem because we can't take advantage of the best treatments out there. But I look at one aspect is exactly what you said, which is what I call saturation. Once we reach a saturation point, the competition drives costs down a little bit. And so we are at that inflection point where saturation should be one of the new factors. But it's also a very precarious place to be, because this is when all of these fly-by-night clinics open up offering, bargain basement pricing for subclinical treatments and dangerous treatments. So we have to be very careful what we access and what we don't. There's another path, though, to acceptance of this treatment, and that is to get regulatory agencies aware of the fact that these are viable treatments and to actually start covering them through insurance. The way I alluded to China is doing, they're making these standards of care so they're accessible to the general population. They've also shortened their time from testing to market. by over 50% compared to us, and their enhanced testing. They have the patient population for it. They're keeping it within the country. The treatments are being kept within the country, so it's mostly for Chinese patients. So they are light years ahead of us with developing these other treatment protocols and driving costs down. So we have to make it an acceptable treatment through insurance. There's no reason why an insurance company or a regulatory agency shouldn't cover the cost of Crescel to minimize diabetic foot ulcers from developing, because it's going to save millions of dollars and suffering in the long run and enhance people's lives and their longevity during the process. So I look at it as saturation and regulatory agencies getting involved for approval.
Well, and I was going to ask you about that, because I think as much as we hate the idea, I think we generally hate the idea of economics driving decisions in healthcare. At the same time, if you can show insurance companies that whether it's Cressel or stem cell or whatever the treatments are, if that's going to save them money in the future, and the benefit is that I get a better standard of living as I age, I think that helps to drive what you're talking about. Is that right?
Absolutely. That's exactly the point that I'm trying to make, is that we can keep costs down. And unfortunately, it is a cost-driven field and society, because healthcare is so exorbitantly expensive in this country that we have no choice but to look at it as a financial decision also when we're making these decisions about our care. I absolutely believe that if we frame this as preventative and cost saving, that we can move forward, and there's no reason why we shouldn't, whatever the treatment be. As you said, if I could design a perfect protocol, let's say your listeners are wanting to enhance the function of their daily lives, I would bring it down to basics. If money were not a factor, if insurance covered preventative treatments, I would have people on certain basic supplements, a few, not a million, because I also see patients coming in on 20 different supplements that are interacting and making them sicker. So we have to do a detox, clean them out, and start adding things back one at a time. But it would be certain basic supplements. It would be an exosome or stem cell infusion every year, once a year. It would be ozone treatments 3 times a year to detox the system, something called EBU. It would be plasmapheresis to detox the system once a year. It would be a cleaner diet, low fat, high protein, low fat, low carb diet, if medically there were no contraindication to that. It would be 3-time exercise a week, things that are very manageable, and it would be at least one social interaction a month, because social interactions are critically important for longevity and overall health and well-being. And so that would be sort of an ideal protocol for every aging person if we could live that. And it's not that expensive to intervene on the levels that I just mentioned. It's certainly cost effective. I have a was a diabetic patient, and all she did was, she was diabetic on medication for 10 years. All she did under my supervision was clean up her diet. She radically changed her diet, and she added 3 times a week exercise to her regimen. And within 1 year, she is not diabetic any longer. She does not require medication for her diabetes. That to me is enhancing the quality of her life every day and adding years to her life, not having to deal with a chronic disease of diabetes. So we can make changes relatively simply. It's about mobility and food, and then adding the additional treatments to decrease the development of inflammatory reactions as we go along and as we can afford to access.
I love that. And I want to ask you too, where does some of your work in the science and the fields that you're in also, I guess, maybe marry up with the ideas that we're getting closer to, I think, being able to go in and do genetic testing? Let's say on myself, I go to, a pharmacy, a big box pharmacy, get blood work done, and then they can develop the compounds for the different medications that I might need that I can respond best to, versus the one size fits all approach that we're currently in.
Well, one size fits all doesn't work. We know that already. It has to be tailored to each individual patient. And that's what regenerative medicine is. That's why I said to you, I see people with 20 supplements and we have to take them off of it because that's not appropriate for every patient, right? Some of them need the omega-3s more than others. Some of them need more vitamin D for brain health. Some of them need more magnesium for sleep and for GI function, but not all three. And so everything has to be tailored towards the individual. And those genetic tests, we're at the initial stages of them. The only problem I see with it is sometimes it returns such a massive report of things that you're at risk for that you don't know where to start. You know, what do you do to prevent these things from occurring? And some of them you can't prevent. Some of them are just genetic predetermined and you're going to develop it, and it becomes an issue of how you manage it. Right? So how do you manage that disease process that you've unfortunately developed also? So when I look at longevity and regenerative care medicine, I look at two aspects. I look at the preventative aspect, and then I look at the management of diseases that have already developed aspect. So both of those are critically important.
Okay, that makes total sense. And many of our listeners are hoping to maybe not live forever, but they want to be healthy enough to get down and play with grandchildren, maybe see grandchildren, high school graduations, marriages, that sort of thing. How close are we? It sounds like we're walking through the door, but tell me, how close are we to having these goals really achievable for most of us? Again, going back to, genetics and accidents and all that sort of stuff plays, but
Actually believe that we are on the cusp already of being able to achieve those sorts of goals. I think they're very realistic for us. I think that it comes down to those basics that I keep harping on. One of the things that I see that is the most debilitating as we age, and I've watched this in my population over the last 30 plus years practicing medicine, one of the things has been the increasing sedentary nature of people's lives. Movement and mobility is critically important. I often joke with my older patients as they talk about their aching joints, their knees and their hips, and we joke that it's about oiling those rusty hinges. Well, I believe that those hinges stay oiled if we keep moving them and we don't end up in a sedentary lifestyle that's mostly sitting and sit to stand activities. So we have to get down on the floor with the dog or with the grandchildren and play with them. It doesn't have to be formal exercise, but we can also take that Tai Chi class once a week or that aquatics class once a week to maintain mobility. So I actually believe that separate from the fancy parts of regenerative medicine, that we already have those goals achievable if we approach it a certain way. Now, obviously, you can't prevent the things that you alluded to, some of the genetic developments of different diseases, or if you have an accident. So I have an example. I have a 92-year-old patient who was completely independent and active, and she had a fall and she fractured something and it left her bedbound for a month. That led to severe debilitation and deconditioning in her condition and situation, and we've actually been rehabbing her. And at any age you can do that with physical therapy, so with exercise, with stretching, with proper diet, with social interaction. She has been able to restore her life at 92. We talk about a fracture and a fall at 92 being the first step to to ending your life, right? With her, we did the exact opposite because we believed in mobility and mobilizing her and the physical therapy and the food aspect and the social interaction aspect. We did also give her intravenous, she could afford intravenous exosomes to help her healing. Exosomes is another aspect of regenerative care that we utilize, and she has done phenomenally well. So I actually believe that those things are already within our grasp if we approach it properly, and movement is the first and most important thing that we have to restore and or maintain.
Well, and I love that you brought that up because watching some of your YouTube and doing some of the research, you talk about people that have had torn rotator cuffs, and these, whether we want to call them sports injuries or just movement injuries or getting old. How does longevity in regenerative medicine help with those things that used to be, as soon as you see an orthopedic surgeon, it's like, I'm going in, I'm cutting, this is where we're going. But we also have degenerative disc disease and hips and all that stuff. Where does some of this medicine and some of these new treatments come in so that we can avoid those surgeries?
Yes. I'm passionate about this topic, absolutely passionate about this topic, and it is the mainstay of what I do every day in my practice, in my clinical practice. And so I absolutely am of the belief that we can regenerate some of these tissues by using different biologics, growth factors that come from stem cells, exosomes that come from stem cells, and stem cells themselves. We can absolutely do it. I have done it in my practice. I had a patient who had what I call end-stage osteoarthritis of her shoulder. She had no normal architecture in there. She had no rotator cuff left. The tendons were completely destroyed. The capsule of the joint was destroyed. The bones were looking irregular. She had no movement. Tears would stream down her face if she tried to move it. And I said to her, I think you need a shoulder replacement. I don't think regenerative medicine is going to do this much. And she begged me to try it. She said, look, I have nothing to lose. I can afford to do it. I will never forgive myself if I don't try it. And so I said, okay, I'll try it. And I injected her with a combination of growth factors, which are a product, again, from stem cells. She came back to me in 3 months with full range of motion in her shoulder. No problem, no pain, no restriction, no clicking, no anything wrong with it. It took me another 2 years to convince her to let me re-image it and do another MRI where we proceeded to see that she had grown a new joint. Now, if insurance would cover these treatments, can you imagine what we could do to avoid painful surgical procedures and the suffering that people go through? You know, shoulder replacement is one thing. Rotator cuff repair is even worse than actually replacing the joint. It's a year of recovery, pain and suffering and rehab. So if we can inject these products directly into osteoarthritic joints, end-stage arthritic joints, sports injuries, degenerative discs. I had it done to myself. I had an injury about 15 years ago where I fractured 2 vertebrae in my lumbar spine, and I developed severe degenerative disc disease and facet joint, weight-bearing joint disease, and severe chronic pain in that area. And I actually had a colleague inject stem cells, growth factors, and exosomes into the disc, into the facet joints, into what's called the epidural space, into all the muscles around there. And I did not improve in the first few months. And I thought, wow, here I am promoting these treatments. I get it done, and it's not even working. But on the 5th month, it was like a switch was flipped. And all of a sudden, literally all of a sudden, my pain went away. My mobility returned. And that was just a non-surgical injection treatment that took an hour to do. And so that's my battle, is to get insurance companies and regulatory agencies to recognize that these are viable treatments for patients and be able to offer these treatments. That is a hurdle that is a very tough one right now. And so we're starting to test these things and starting to get recognition.
Well, a couple of things to follow up on that. And this is me being kind of, ignorant of what's going on in the science and regulations and things. But I remember a long time ago at this point, all the yelling and screaming about stem cell and stem cell research and fetuses and all these different things. And based upon what I've learned from some of your materials, that's not necessarily what's being used. And so I just want you to talk a little bit about that so that people like myself, that's what we knew. And so when we hear stem cells, that's what we're thinking. Help educate us a little bit about that.
So that has nothing to do with the current state of treatment at all. That would have to do with research when they're researching what are called embryonic and fetal stem cells, which are obtained before birth. Every product that I'm talking about now and that's being used is obtained after birth. It is literally the products that are thrown away after a baby is born. The placenta, the amniotic tissue, and the umbilical cord, something that some people have saved for future use. But basically it's the products that we throw away. So we are harvesting the active ingredients from that product. So there is no ethical issue whatsoever. This is essentially garbage that we're then utilizing and repurposing to great purpose, actually, because this is what keeps the fetus alive in utero. Imagine what it can do for a 60 and 70-year-old who's developed degenerative changes in a particular part of their body or cognitive dysfunction. If you can introduce these products intranasally to affect the central nervous system, there's tons of application variables that we can utilize to maximize these treatments. We just have to be able to access them.
Okay, that's great. That helps me out. Like I said, initially when because I've got so much other stuff and it's not my field, I hear stem cells and I think back to those arguments and headlines from ways ago.
Not a factor at all, and everything is ethical and postnatally sourced. And as a matter of fact, the products that I used are from C-sections, so they're from a very clean source, because the vaginal source is a dirty port. Basically, it's not a surgical field, and so it's from C-section product that is literally being thrown away after the delivery. The woman agrees to donate the afterbirth, and that's how the product is obtained, and then we process it from there. So it's actually all above board and postnatally derived.
Cool. I mean, I don't know. I geek out on some of the science stuff.
Yes, so do I.
It's fun. I want to pivot over again and talk about China and their aggressive investment in regenerative medicine, and maybe what are they doing more structurally and culturally than what we're doing in the United States or even maybe in the West?
Well, one of the things that they're doing, which I already talked about a little bit, is that they are developing tracts specifically to study and apply regenerative medicine and biobotanicals to care, which is something that we have not jumped on in full force. The other thing that they're doing is that they're changing the pathway, the regulatory pathways to approval. And so they basically have continued with the basic concept of safety and efficacy first, and they are very stringent with their safety regulations. But once they've crossed the threshold of safety and efficacy testing, they immediately bring the product to market while more testing is being undergone, and they are funding this testing, and they're allowing insurers to pay for these treatments, which is something that we are nowhere near doing. So structurally, they bring the product to market much, much faster than we do. If we could bring it to market, we would have access to all of these alternative treatments, because safety is, if we can prove it's a safety issue, then we can worry about efficacy after. If I'm not going to hurt somebody and I have the opportunity to help them, that's what I'm going to do. And that's the approach that China has taken right now. And so they are light years ahead of us when it comes to approving these treatments. They also, as I said, and I keep harping on the biobotanical concept, that is where future healing and longevity is going to be stemming from. And they are also light years ahead on that. We don't have any studies on biobotanicals that are funded by serious regulatory agencies that are being acknowledged by the powers that be, that these are viable alternative options to treatment. We have to acknowledge that and recognize it to compete with China. They're going to leave us in the dust if we're not careful with this.
Yeah. Do you think that in our regulatory, and I'm asking you to share with us, is there more of a case of established treatments, established industries fighting against something new versus somebody that's just playing devil's advocate about show me how this doesn't hurt somebody?
I think it's both factors. I mean, obviously, big pharma runs society the way we're living it. They absolutely have so much power, and they're not going to like it very much if I turn around and say that patient doesn't need that drug for the osteoarthritis in their knee because I just injected a product that regenerates the tissue and decreases their pain. So obviously that's competition on the most basic fiscal level imaginable, and that absolutely is driving some of the opposition to this. But I think we can get around this, actually, because there's enough push from the general population now and demand from the general population for these other treatments that I think the government is being forced and the regulatory agencies are being forced to look at it. It's also part of the MAHA movement now. they want alternatives to treatment. They want longevity care, regenerative medicine, biobotanicals. They want to move in that direction. And so these are things that will work to our benefit. We're confronting this with Crescel right now because Cressel, even though it's over the counter, we want to market it to certain populations and believe that it's perfectly poised for mass use, let's say in the military. In the field, for injuries that occur in the field, we can stop bleeding immediately and we can prevent some of the complications that happen from the wounds immediately. We want to deploy Crescel across the board for regeneration, for diabetics, for foot ulcers in large scale, and the government is not willing to pay for it and patients can't afford it. It's driving me crazy. And so we're going through these regulatory hurdles to try to figure out how we can fit into a category or develop a new category. So Crescel might in fact be the driver for a new category in the United States for regulatory processing of agents like this.
That'd be awesome. I'd love to see that come to pass. And what I want to do too is move over a little bit and talk about what are some of the misconceptions that people might still have when it comes to aging, because I think sometimes it's treating symptoms and not being as proactive as maybe we should. But
so I think the biggest misconception that I see is that we have no control. I hear that over and over again from patients. They kind of give up and they say, yeah, I developed this and it was inevitable that I was going to develop it, and just give me a pill, to treat it. That paradigm is shifting a bit, and so I'm trying to get my patients to shift with that paradigm shift, because they're still stuck in the I have no control, and we do have control. We have control over what we put in our mouths. We have control over whether we stretch or not, or exercise. We have control over whether we have social interactions that enhance our daily lives. We have control over whether we seek out a different alternative supplement to one that wasn't working. We have control to take these steps, I think. And so when I look at misconceptions about aging, the biggest one is that these things are inevitable. And some of it is inevitable, but some of it is not. And we can improve the quality within the components that are still inevitable. And so I am of the belief, I always look at the glass half full, not half empty. And so I'm always looking at the things that we can do to enhance the function and the quality and the duration of our lives. So I'm always fighting against that misconception of we have no control.
I like that. And yeah, I am definitely hearing more and more people saying, no, you don't have to just settle that this is going to be the way things are. You can change your diet, get moving a little bit, doing these things. And so I love hearing somebody like you talk about that. I do want to ask you about what have been some of the, let's say, paradigm shifts or aha moments that you've had personally as you've started in on your career in regenerative medicine and the bio
botanical world.
Botanical there, yeah. I keep wanting to go.
I love it.
Bios,
I love it.
not botanicals.
For me, it's been, it's been two things. One is watching people age over the last, as I said, 30 plus years, and watching that thing that I talked about already and have harped on about them becoming more and more sedentary. But some of the other things that I've become very excited about are the ways in which we can intervene, like Cressel, right? Like the fact that I want to convert that into something for systemic processing to decrease that inflammatory process, to decrease aging. I absolutely have been informed by the decisions that my patients have made over the years, and I've seen the direction that they've taken, both positive and negative, to their own detriment sometimes over-obsessing over every disease process, sometimes not thinking they have any control over it. I've watched all of this over the years, and that informs how I make decisions in my own life, and I am a living example of that. My parents at 65 were elderly, and they were overweight, and they had multiple disease processes and were on a slew of medications. Me at 65, I may have some of the genetic disorders that they had, but my lifestyle is so totally different. The way I manage those disease processes is so totally different. My diet is different, my activity level is different, and my functioning is therefore different as a result. And if I could therefore drive any one thing home about the things that I've learned over the years, it's that we do have control over the direction that our lives are going physically, musculoskeletally, that we can try to enhance function through simple measures. Look, I'm not rich, but I did access treatment for my back. It was very expensive, but I did it with the hope that I could treat it once and have it managed. And so we can access treatments like this at this point. There's no reason why we shouldn't. And so I absolutely believe that we can enhance the quality of life within the days that we have. I have patients that unfortunately pass on through different heart attack or whatever happens, but the quality of their lives during those days that they were alive, I hope, were enhanced by the work that we've done together. I'm sure of it, as a matter of fact. We talk about it. So if I could leave with one message, it would be that don't stop moving, eat properly, and try to access the different treatments that we have that are coming up now that are anti-aging, that we know that there's some evidence for. I am trying my darndest on the legislative level to get it approved so that people can access these treatments. I hope that people then can educate themselves and actually learn the direction to go with simple measures in their lives. We talk about family interactions. It's critically important that families start talking about the aging process and how they're going to support each other through that process. And I talked about Eric, the quadriplegic. It's a great story about Cressel, but it's a bigger story about family interaction and support and what that family love and support did to enhance the quality and longevity of Eric's life. So those are the kinds of messages that I would want to pass on.
I love it. And I know our Grand Tribe listeners are going to get a lot out of this. As we start to wrap things up, Dr. Shapiro, is there anything I haven't asked you or anything we haven't touched on that you would like to bring up?
No, just my excitement, again, to harp on the Cressel thing and the systemic applications and the future of what it can bring about, because we already know the topical application of it and how it works and how it penetrates the mitochondrial level. And we see that based on the responses we get. And I love to look at that because we're literally changing people's lives. We don't think about skin conditions as debilitating, but somebody with facial rosacea or eczema, they know how debilitating and socially stigmatizing those things can be, and it affects their daily life. And so if I can have an effect on that level and minimize the symptoms that are so apparent, let's say facially, cosmetically for patients, and then if I can take that and utilize it systemically for systemic disorders to decrease the inflammation, to enhance blood flow to organs, I am so excited about the future of that.
Well, I love it. And the reason I'm smiling for folks watching with YouTube is that I've got some nieces that have some of these skin, the rosacea and some of these things. And as they were growing up, that was very hard for them to manage and to deal with. And I think probably especially for young women versus boys, although boys
Yes.
also care about appearance, but it's different, right?
Yeah, it's different. It's devastating for young girls to go through their teenage years like that with the redness, the erythema, the inflammation, the pustules, and they look like they have acne breakouts. It's devastating for them when everything is about appearance at that age and social acceptance. It also is devastating for older women who don't even have proper makeup because the makeup irritates the skin. And so Cressel is really incredible because rosacea is a condition of excess blood flow, pathologic blood flow to the skin surface, causing that redness. And Cressel actually decreases that pathologic excess blood flow. But then you have conditions like Eretz, the quadriplegic, with wounds that are lacking in blood supply, and Cressel actually increases blood supply to that area, which proves that it's an intelligent therapeutic, which proves that it's working at the mitochondrial level and literally morphs to whatever the disease process is that's necessary. So enhancing blood flow, minimizing blood flow, whatever is necessary at that particular junction for that disease process. So again, I'm really fascinated by this product and where it's going, and am very excited about the future.
Well, and yeah, I could geek out with you about this stuff because
Yes.
because I get really interested, because this sounds like it knows what it needs to do.
Exactly.
It's not like, hey, here's one version that increases blood flow, here's another version that decreases. This, as it's applied, figures out what it needs to do, and then
Exactly correct. There's a complex set of interactions that occur and technologies that occur for that to happen, but it literally morphs into whatever is necessary. That's exactly right, which makes it fascinating and applicable for all sorts of disease processes. Like your relatives with rosacea as teenagers, it would have been perfect for them. We actually just completed, and I won't bore you and geek out even more on this, but we just did a fascinating study on rosacea where we compared it to the standard of care, which is a prescription anti-inflammatory called metronidazole. And the Cressel, the plant-based biobotanical topical agent, for a fraction the cost of metronidazole, blew it out of the water. We had 54% reduction in erythema versus 23% in the metronidazole population, and 74% reduction in lesion count versus only 17% in the metronidazole group, which wasn't even statistically significant. We're now doing a study on diabetic foot ulcers, and we're very hopeful for the outcome of that. But this is incredible when we put it up against the standard of care. And so again, you start to say, what is the matter with us? How are we not recognizing something that's cost effective and can prevent social stigma in young people and can help the quality of life so dramatically? Like, what are we not getting about it?
I love that. And yeah, that's some good questions to kind of end on. Certainly ones that you could, have with friends at the pub or
Yes.
whatnot. You're right. Is
Exactly.
when you're sitting with your best friends and you're trying to solve the world's problems, this is a great one to work out.
Exactly. And I would love it. And I would love to be able to say to all the grandmas and grandpas out there, keep getting on the floor with your grandkids and playing with them. It's good for you. It'll keep your joints moving. We'll help you get up after you get down there.
That's awesome. And Dr. Shapiro, where's the best place for people to either get in contact with you or follow your work or, learn more about Cressel?
It's just to access me on the internet. That way, when you put my name in the internet, you'll come up with lectures that I've given and different things that I've done. And from there, it can be a launching point for research into the regenerative medicine longevity field. So it's the easiest thing is to Google me and find me that way.
That's awesome. And we'll be sure to put that link also into the show notes, just
Great.
to help people out if maybe a few of us like myself are maybe Googly challenged.
Yes. I get it. I am too. Anyway,
right.
This has been such a pleasure to talk to you. I love conversations like this. Anything that enhances people's knowledge about the quality of their lives is something that I am all up for doing.
Awesome. And thank you so much for being on the Grand Tribe podcast. We really do appreciate it.
Thank you for having me. It's been a pleasure.
The moments your grandchildren remember most are the ones you share together. With Rhodes Scholars Grandparent Adventures, you'll explore incredible destinations, learn from expert instructors, and discover the world side by side. From national parks to wildlife encounters and hands-on cultural experiences, these programs are designed to bring generations closer through the joy of learning and travel. Learn more at rhodesscholar.org/grandadventures.